Hello, I'm here with Paul Frick, University Distinguished Professor and Chair of the Department of Psychology from the University of New Orleans. Dr. Frick is an expert in evidence-based assessment for child and adolescent mental health problems. So today we're going to be talking a little bit about how parents can find a little bit more out about youth mental health assessment. So, Dr. Frick, one of the first questions I think that a lot of parents would want to know is if they're concerned about their child's feelings or problems, behavior problems, who can help them figure out whether it's actually a mental health problem?
Yeah, there are actually two stages to that question. One stage that parents often is it something that I even should be concerned about and get an evaluation? And there, most often the person who parents go to, and actually they tend to be very good at helping parents determine whether they should take the next step, are primary care physicians like a pediatrician or a family physician. They're often in a good position to know, should the child get more testing and get an evaluation for mental health problems. Then once, the parents decide, and usually with the help of a physician, that they should, typically, the people who are in best position to do testing are psychologists. Now, I want to make it clear, I am a psychologist, so maybe there's a bias there, but it's one of the things in the training of mental health professionals that is usually more emphasized for psychologists than for other professionals. And so, the second thing is I recommend a psychologist. The third issue is, usually getting some recommendations about psychologists who sort of specialize in testing, because some psychologists, even though they were trained, really don't do it a lot and don't get specialized training. Now, if a parent is having trouble finding out who's good in a community, one thing I recommend is typically calling a university and talking to either the university clinic, because there, oftentimes professors who are in the university have connections in the community. And if they can't offer the services at the university, they typically know who would do a good evidence-based assessment in the community.
The other thing that parents might want to know once they go into the community, how can they tell that their child is getting an evidence-based assessment?
Yeah, that's tough because you often have to rely on the professional to give the recommendations. But the two things I usually tell parents that they can look for. One is how much the person is involving them and others, like teachers, in the evaluation. People who don't do an evidence-based assessment typically just take the child in and do a lot of testing of the child without involving the parent and teacher. And so one thing is the person doing the evaluation really should be asking the parents for a lot of information about what their concerns are, how things are at home, how they respond to the child, have them fill out rating scales and answer questions, and be doing the same thing with the school. And so I think it's really important that the parents, a lot of times parents, really, in some way it's easier on parents if they just drop their child off and have them tested, but that's really not the best approach to assessment. The second thing I often tell parents is really feel free to ask the psychologist what they're doing and why. And the psychologist or whoever's doing the testing should be able to explain to them, I'm testing your child for attention deficit disorder, and here's what I'm looking for to determine whether it's there. Here's what I'm looking for to make sure it's not something else. And I think, again, the parents may not understand a lot of the technical aspects, but a psychologist should be able to convey it, at least in those simple enough terms, if they're doing a good evidence-based assessment.
Another thing, are evaluations separate or are they part of treatment?
It's done both ways. The way we've typically done it is we do have a kind of standalone assessment service. And a lot of clinics and a lot of psychologists will do standalone assessments prior to treatment. And this is usually done because they want to make sure we know exactly what's going on before you decide what to treat. If you're going to want to treat, say, a child who may be depressed, you're going to want to make sure depression is really the problem and not something else. So it's typically done prior to treatment. There are a couple exceptions to that. Sometimes something is so acute, and what I mean by that is something that really can't wait too long, and so a person may start treatment just to get things under control. Let's say a child maybe is suicidal or maybe is in danger of hurting somebody else. They may start treatment immediately to help reduce the risk to the child while they're doing an ongoing assessment. The other thing that I want to make clear is that when we're talking about assessment, often there's an initial assessment to determine what's going on, but any person who's doing a good evidence-based treatment should have ongoing assessment throughout the time they're in treatment. So it isn't like the assessment starts, it's done, and then treatment starts and there's no assessment. The assessment should carry through treatment. The reason that's important is they want to make sure the child is getting better with treatment, and there should be a mechanism for doing that.
So how much time do evaluations usually take, and how much does it usually cost?
Yep. This is why a lot of professionals that are in private practice won't do evaluations, because to do it right is very time intensive. They typically are between 4 to 6 hours of just doing the testing, and then there's about another hour of going over the test report with the parent, describing it to the child. So it usually takes at least 4 to 6 hours to do the evaluation. And the costs can range from usually $800 to $1,100 for an evaluation.
Okay. So is there anything else that parents can do to help once they get an evaluation?
Several things that parents can do. One thing is we find it's very important to have a lot of information about the previous tests that the child may have had. And this may be that maybe they were evaluated by their pediatrician or evaluated by another psychologist. Or it could just be most schools now are doing regular standardized testing. We also ask parents to bring in things like report cards and anything from school that they may have. For example, if a child is having trouble in math, we ask them to bring in math tests so that we can see exactly what problems the child is having in school. We also ask the parent to make sure they know any medication the child is on. And not just behavioral medication, but medications for asthma, medication for other medical conditions can often have behavioral and emotional side effects. So we want to make sure parents are very clear in terms of what medication the child is on. And the third thing is just helping to prepare the child for the testing. What often happens as a child is brought in and a parent in some way conveys to the child, you're going in there because you've been acting bad and we want to see what's wrong with you. That makes it very difficult to get a child being a willing participant in the assessment. And so if parents can really help set the stage, and again, you'll have to do it in a different way for children that are younger versus adolescents. But the bottom line is what you want to convey is, look, the child will know that there's probably things going on that the parents are concerned about. You can't hide that. But what you want the parent to try and do is to tell the child, we want to know how to help you better. We want to know how the school can help you better. And so what this testing does is it gives you a good picture of your strengths and weaknesses. The way you learn, everybody learns better some ways, other people learn better in other ways, and we want to find out that. They want to find out how you're feeling, how you behave, how your friends are. And again, just to get a good picture of all your strengths and weaknesses. With that, then we hope we can get a better idea of how we, the school, or anybody else might be able to help you. And so it sets a different frame than you're coming in because you're bad and we're going to find out why you're bad.
Great. That was very helpful.
Okay, good.
Thank you very much.
Sure.